Okay, we're a go here, folks. Can I have your attention? Can I have your attention? So good morning, friends. Our moderator is a real pro. He's a veteran journalist, national network. He is a professional at this. He moderates debates, formal debates that are broadcast on NPR. And he's also the author of a best-selling book on autism, which is obviously a close issue with us. Let's welcome to the stage John Donvan.
Thanks, Hal. Thank you. Good morning. Good morning, everyone, and welcome to the inaugural edition of the NUHW Candidates Forum. I'm John Donvan, and I will be working here as the moderator of this program, but also working with me will be a panel of esteemed journalists, reporters who live and work in your state and in your community and who have covered the issues that matter to you and will be bringing the key questions to the candidates who are standing up in this forum. So let's begin right away by welcoming one at a time, and to a round of applause each time, the reporters who have given of their morning to be here and take part in this exercise. Please, let's first welcome state government reporter for the LA Times, Melanie Mason. This applause is working very well. I just want to let you know. Next up, he is past national president of the National Association of Black Journalists and a longtime well-known reporter for KCBS in the Bay Area. Please welcome Bob Butler. Next from Telemundo, based in LA but a national correspondent for Telemundo, please welcome Maria Paula Ochoa. And completing the panel, he is a political reporter for the Riverside Press Enterprise and Southern California News Group, which represents 11 newspapers around the state. Here is Jeff Horseman. Now, a little bit about my role. I'm also a journalist, but I will be here functioning as the moderator. That means that the key questioning actually is going to come from these journalists and also from selected members of your union. My role as the moderator, and I have moderated now more than 100 debates in the last 9 years, and this is not strictly speaking actually a debate. It's more of a conversation with a competitive edge, let's put it that way. My role, though, is to make sure that the conversation stays on point, to discourage pivots away from the questions at hand, to make sure that the questions that are asked are actually the questions that are answered, to discourage as much as possible too much devolution down the personal attack path, because I know that you know these issues and you actually have to make an important decision at the end of this program, and you actually want to hear what each of these candidates would stand for in office. So my role, as much as possible, is to keep us from going off the rails in that regard. And ideally, I won't have to get too much involved in that at all, but if I have to, I will step in. Over the next 90 minutes, here's the format. We're going to go through 7 rounds of questioning. Each of those rounds is basically the same. In each round, every candidate is asked a question. Every candidate is given 1 minute to answer that question. And in terms of that minute, we're going to be pretty tight about enforcing that. They have a clock that they're going to look at, and there's going to be a bell that sounds like this that we can all hear. That bell means to the candidates, stop talking, and please yield the floor. But after every candidate has had a question, and it can be the same question to all candidates in some cases or different questions to the candidate, after that round of each candidate answering a question, then on the themes that have come up, we'll have a 4-minute discussion in each round. 3 of the rounds will be prompted by questions from your membership. They were solicited from NUHW members, and the questions were chosen by the NUHW without input from me. The other 4 rounds of questions are going to be prompted by each reporter getting a turn at asking all of the candidates, and they have decided on their own what the questions are. The union does not know what their questions are. I don't know what their questions are. That's up to all of them. So that's basically how it's going to shape up. Again, our expectation is that the candidates will really bring their full game to this today because they know what the stakes are. They know what's going to happen afterwards. But let's start then by bringing all of the candidates to the stage. And in the interest of fairness, in terms of speaking order, we've just decided to go with alphabetical order or reverse alphabetical order, arbitrary in both cases. But let's start with alphabetical order. And please welcome to the stage, and again, with a warm round of applause, your candidates for governor on the Democratic side. Please first welcome John Chiang. And next up is Delaine Eastin. Next we have Gavin Newsom. And completing this panel, Antonio Villaraigosa. And as we get set to go to opening rounds, I first want to bring back to the stage your president, Sal Rosselli. We're going to have a little bit of a chat about how this came to be and why it's so important. So let's please welcome your president back to the stage. So Sal, just to reiterate, let's jump to the end. This is prelude to something important that's going to happen right afterwards. Tell me about that.
Actually, this is the culmination of an organizing education process over the last 3 months where we've had scores of meetings from Eureka to San Diego and NUHW hospitals where our members reviewed very comprehensive questionnaires that our candidates submitted to us, debated their preferences, discussed it with their stewards, and today 350 of our elected stewards will vote the union's endorsement. Hopefully will endorse the next governor of California.
And an event like this is not easy to organize and pull together. It's much more complicated than sending out a questionnaire. Is this a first for the union to be doing this?
It's certainly the first of this scale. You know, we have our members interview candidates and make the decision for the union's endorsement as much as possible because they have that power. They should have that power. We're a very democratic union. It's bottom up.
And why did you pick this time to do this kind of event?
Well, it's a pivotal moment in our history. California needs to play a leading role in the discussions around issues that, frankly, the federal government has dropped the ball, like healthcare, immigrant rights, the environment.
What are you hoping that these candidates will bring to the stage today?
Well, healthcare is a major issue of our time, and its future is at risk. Mental health care awareness is increasing, thank goodness, but achieving parity, we're a long way off from that. So we need a pathway with a clear vision and a strong governor to carry out that vision.
My last question, where are the Republicans today?
John, we invited them, they didn't respond. We wish they were here, frankly.
All right, well, we have 4 people who did show up, and we're going to hear from them all. Thanks so much, Sal. So, in terms of opening questions, then, we're not going to actually begin with opening questions. We're going to begin with opening statements. And in this case, and just in this instance, and maybe again at the end to shake things up a little bit, we're going to hear from the candidates in reverse alphabetical order. Again, reminding you that they're given 1 minute to speak. If they hit the minute, we'll hear a bell. If they come in under, we won't hear a bell. Fewer bells is better. But first, to make his opening statement, please welcome as warmly as you can Antonio Villaraigosa. The floor is yours, sir.
I want to thank you for holding this democratic debate that's so important in these times. More importantly, I want to thank you for being on the front lines. The front lines of the fight for universal health care, for the notion that health care is a right, not a privilege, for mental health parity, for the idea that who better to protect the rights of our patients than the people who work with them every single day. I've been on those front lines as well. I was a union member, a union organizer. I was a chief steward, and president of my local, a 5-state local in the 1980s. My whole life, I've been standing up for the rights of working people. And I believe that the next governor is going to have to stand up for the rights of working people, to fight for a California where we're growing together, not leaving so many people behind. A California where we're graduating more of our kids, training them and educating for the jobs of the future.
Thank you very much. And please now a round of applause for our next speaker, Gavin Newsom.
Thank you all. Well, first, let me acknowledge Sal Roselli and the extraordinary leadership of this union, and let me acknowledge the development of this union as a model union, a worker-led union. You have been at the intersection of patient care, public policy, also political activism, and trust me, that's not lost on me. I was just over there with some folks from CPMC. I saw in different incarnations that activism firsthand, and the work in Oakland at Children's Hospital, down here at Fountain Valley here in Orange County, and the work, of course, the epic struggle over 5+ years at Kaiser, the work you're doing at USC, which I was introduced to last night. This is an example, I think, of a remarkably enlightened approach to bottom-up leadership that is demonstrable in terms of your organization of this first candidates forum, but also in bringing to the fore the most critical issues of our time, and those are the issues of health care, mental health, issues of parity, substance abuse, and of course the fundamental issues that define all others, immigrant rights and workers' rights.
Thank you, Gavin Newsom. And our next speaker, Delaine Eastin.
Thank you.
Good morning, NUHW, and thank you very much for making this a better and healthier state. Our democracy is in serious trouble, and it isn't just Donald Trump that's threatening us. It's the lack of faith in government and the lack of faith in one another. So we together have to begin dreaming again. Too many of our leaders are not dreaming about the real people having really great opportunities. We need to fight for free and excellent public education for everybody from preschool to graduate school. We need to be on fire to give affordable housing for everybody in California, not in 25 years, but today. Right now, we've got to get working on it. We need to make a commitment to everyone in our state has a fundamental right to breathe clean air and drink clean water. And finally, we need to pass SB 562. And we need, let's create single-payer healthcare system for all of California. Today in California, we need to be on fire for equality, justice, peace, and optimism. Thank you.
And now, John Chiang.
Well, thank you. Thank you, Sal, and thank you, NUHW. It's an incredible honor to be with you. You truly are the backbone of California. Like all immigrants, my parents came to this country dreaming of a better future. They understood that America today is the most aspirational place on this earth. As the oldest of their 4 children, I've always been the one to assume responsibility and take care of others. We've been in this fight for over 20 years together. When I was your state controller, I took on Governor Schwarzenegger when he wanted to pay the public servants federal minimum wage. When today, I'm taking on the big drug companies who are flooding various communities throughout the United States of America with opioids, poisoning our communities. And then today, I'm the person who's standing up to Wells Fargo. We have to take on Wall Street when they want to rip off innocent Californians for millions of dollars. I have always fought for you, and I will never stop fighting for you. Thank you very much.
And now we move on to the first round of our first 7 rounds of questions, and this one will come from the panel of journalists. Remember, again, each candidate gets 1 minute to answer, controlled by the clock and the bell, and then after the round of questions, we'll have a 4-minute discussion period. And asking questions first from the Los Angeles Times, Melanie Mason, you get the first crack. The floor is yours.
Good morning.
Good morning.
Good morning.
So, Mr. Chiang, a recent UC San Francisco study found that California is facing an acute shortage in primary care doctors. How, as governor, would you increase the ranks of physicians to underserved areas, and would that include increasing reimbursement rates for doctors who see Medi-Cal patients?
Yeah, we absolutely know that healthcare is vital to all of us in the state of California. You live it on a daily basis. We have to make sure that all communities today get access to appropriate healthcare that's well-educated, that's well-trained. So as the state's banker, as the former chief fiscal officer, I've been working very aggressively to make sure that we have more money over the years. I helped get California through those very difficult recessionary times. And so it's time that we make those investments in medical schools, investments in various communities to make sure that we have access to more primary care professionals throughout the state. We don't have a medical school in between Northern California and Southern California. We know the Central Valley is starved of those particular access. I went and visited UC Riverside, looking and visiting with the members of the first graduating class. And so I wanted to make sure that we invest appropriately, that we take the dollars to make sure that we get health care in all the communities that require it.
Ms. Eastin, the cost of prescription drugs has emerged as a flashpoint in the healthcare debate. Governor Brown just signed a new law increasing disclosure around drug prices. Would you, as governor, support further action to curb pharmaceutical costs, such as price controls?
Absolutely. And as a candidate, I have pledged not to take any money from Big Pharma. I'm not taking it from Big Oil or Big Tobacco either. The truth is that right now in California, we really do have a crisis, and it is about the cost of health care. We are spending more than any other country on earth and getting less, and people are dying. So we need to get our act together here and understand that we do need to make pharmaceuticals much more affordable, and we need to make sure every person in the state of California is covered by health care, period, full stop. The reality is that right now in this state, we do need more doctors. Since 1965, we built 6 colleges, the total of 6. And in that same period of time, guess what? We built 23 prisons. Those are not my values, and budgets are statements of values. So let's invest in education, let's invest in healthcare, and let's make sure that the future of this state is about, yes, having affordable pharmaceuticals, but also having enough great doctors on hand to do the work of California's health.
Mr. Newsom, you have said that you support universal health care and see a single-payer system as the best way to achieve that. A state-level single-payer system would require the state to cover costs for all Californians, including those who currently receive health coverage from private insurers. How would you propose paying for such a plan?
Well, we're in the process of deliberating that right now through the process known as SB 562. We need to jumpstart that process anew. I think there's a lot of mythology about the cost of single payer, that somehow we're adding on top of an existing multi-payer system, when in fact it's about reallocating existing resources and using them more effectively and more efficiently by replacing the current multi-payer system. The fact is we're already spending $367.5 billion a year on health care, according to UCLA, in this state, 70% of it borne by the taxpayers. A single-payer system drives down the cost of health care, drives down the cost of prescription drugs through economies of scale, and provides a more effective, efficient, and universal access for those that are uninsured. You still have 3 million people in the state of California without health insurance. And even through Color California, millions of others have seen double-digit increases over the course of the last few years in their premiums. Single payer is the way to go to reduce costs and provide comprehensive access.
Mr. Villaraigosa, you have been a little bit more skeptical about the idea of a state-level single-payer system. So if not single-payer, how, as governor, would you achieve universal health care coverage and access?
Well, what I've said is I support in concept the notion of single payer. I actually authored expanding Medi-Cal to 200% above poverty in 1995 and 96. I didn't have a funding stream, so I couldn't get one vote. And the truth of the matter is SB 562 did not have a funding stream. When you're governor, you got to make the tough choices. You can't just say, I want pie in the sky, because that doesn't put food on people's tables. So what I would do as governor is to create a public option that allows people to buy into Medicare, to address a drug formulary that is out of control, reduce our drug costs, and do everything we can to ensure that we're ready for single payer, because as you know, and you've written, the federal government has to provide us for waivers to do it. So I'm prepared to lead the way as governor of California.
Melanie Mason, you can do a follow-up question.
Trying to.
If you don't have one, I actually.
Actually, I'd love, John, for you to kind of jump
Well,
in.
I'm interested in the other candidate's opinion of Antonio Villaraigosa's attitude that 562 is pie in the sky, that just sort of announcing single payer is a great thing and we can do it is just not realistic. It's not real world. And I'd like to get some response to that, maybe starting with you, Delaine Eastin.
Well, to be honest with you, we're paying the $368 million now. 70% of the people of California are covered by Medicare, by Medicaid, and by some kind of public health insurance policy. So what we're really doing is talking about, yes, slightly more in the short run, but a lot less in the long run. We're now paying for a big for-profit industry that is hosing the state and the people and is not doing a good job by the sickest people. The fact of the matter is people are dying in California because we do not have affordable health care coverage for everybody. It is immoral for us to have situations.
But with respect, that doesn't go to the point of the question where he's saying it's just not, you're talking about what the problem is. He's saying the solution, your suggestion of the solution is not realistic. And I wanted to ask you to address that. I
think the solution is realistic. We have to put our shoulder to the wheel and figure out how we're going to do this. And we can. It could be a gross receipts tax plus partial income tax. I'm not sure exactly, but it's doable, and we can do it if we put our minds to it. There's nothing California can't do if we put our minds to it.
Let's let Ms. Newsom come in.
And in the spirit of Delaine, look, it's a question of leadership. I mean, this is what they said about Social Security and Medicare. You can't do it. Heck, that's what they said when we worked together, Sal and others worked together to create the first universal health care plan in the United States of America at the local level. Regardless of pre-existing condition, regardless of your ability to pay, and regardless of your immigration status, San Francisco provides quality universal health care. And we did that in the midst of the recession in 2007 by being resourceful. The fact is the money exists in the system. The money is not being well invested. A single-payer system provides the ability to provide more efficiency and more cost controls. It's a question of demonstrable leadership. I'm not going to wait around for the debate to unfold in Washington, D.C. Sure, I support Medicare for all, but you've got to shape the debate in California. And with respect, John, to your question about 562, the process was short-circuited in the middle of the conversation. The financing package and all the amendments are being processed and should be through the Assembly.
John, do you want to join this conversation?
Yeah, absolutely. Right. This is a question of will. It's absolutely clear that we have to make up the difference to 2.9 million Californians who are uninsured today. We have to draw more effectiveness and efficiency into the system over the long term. We do have some immediate challenges. We know that we have to make up a $106 billion difference if we want to cover everybody additionally and provide full coverage. Right? We have to figure out how we're going to scale up, what time frame we're going to scale up, look at the efficiencies and efficacy of certain measures. We don't have to go all in to provide all the services all at once. Let's make sure that what we're implementing, we can scale up appropriately and show its effectiveness in the program. But at the end of the day...
Let me bring in Melanie Mason in our limited time.
Well, I'd like to ask a question of Mr. Newsom and Ms. Eastin as the 562 supporters. The bill would essentially replace the role that private insurance companies and the employees that work in those companies, the role that they play. So what do you say to the workers of those industries that you are essentially advocating for replacing?
Well, essentially, it's cheaper if we do this. The reality is, right now, there's a big amount of money that goes into profit. For-profit companies are making a fortune. Meanwhile, really sick people are not being treated. We had a doctor come to the legislature and testify that he had just treated a little boy who was 7 years old. He almost died. He had 107 degrees of fever when they brought him to the emergency room. He went deaf in that year. He almost died. The state of California spent over $50,000 saving his life, but he still went deaf. With just $4 or $5 worth of antibiotics, we could have saved his hearing and not had a $50,000 bill passed on to the state.
But how would you address the jobs that are lost by this massive overhaul in the healthcare system?
You'll lose some and you'll create some.
I want to let Antonio have a word in here because and we're going to give you the last word in this portion of the program.
What I'll never do is sell you snake oil. The fact of the matter is, we don't have a plan yet. That's why the Speaker of the Assembly put that.
You can have 30
bill
more
to
seconds.
rest. The fact of the matter is, we do all agree that we have to get there, but we need a plan to do that. I said to you, I authored expanding Medi-Cal long before people were talking about single payer. I tried to do it, expand Medi-Cal to 200% above poverty. I didn't get a vote because I didn't have a funding plan. But 2 years later, I authored Healthy Families. 750,000 kids got health care. Let's focus on the job at hand, protecting 5 million people who could be in risk of losing their health care as a result of Trump care.
All right. We're going to thank you very much, Melanie Mason. And round of applause for round one. Working. Thank you. Thanks. Now, for question round two, this is our first question from a member of the National Union of Healthcare Workers. It comes from Ken Rogers. He's a psychologist in Sacramento. He's practicing right now at Kaiser Permanente. And the question is going to be answered first by Delaine Eastin. It goes like this. Despite mental health parity laws, many patients still do not receive the same access to mental health care as they do for physical health care. Regulators have not enforced the laws aggressively for enough. For years, many patients at his clinic, he says, have had to wait 2 months for a therapy session. He says things have improved since the new union contract increased staffing, but he says that throughout the state, access remains an issue. Question, what would you do as governor to make sure that health insurance companies comply with mental health parity laws and that state regulators hold them accountable? I'm glad the question came up because virtually all of you in your opening statements hit this issue of mental health parity. But Delaine Eastin, the floor is yours for a minute.
Well, thank you. I will tell you honestly, as a superintendent of public instruction for the state, I spend a lot of time looking into foster care, into children with ACEs. The reality is that we have a lot of children who have tough childhoods, and they grow into adults who have tough mental health issues. And this is as vital as antibiotics, is to be able to get mental health care. The opioid crisis is a mental health crisis, not a drug crisis. The truth is that right now in California, we need to be on fire to improve the mental health of the people who live here. We've got more people living on the streets than I have ever seen in my life. And you can see that many of them are people that have to have mental health support. And if we do a better job, Switzerland, tried cracking down on opioids and cracking down on on the problems with drug addiction, and they had a huge problem. It wasn't getting better, and then they decided to switch what they did, and they focused on mental health, and now they have zero opioid problem. And I think we can do that in California.
The question now goes to Gavin Newsom. I'll repeat the actual question when it's phrased as a question. What would you do as governor to make sure health insurance companies comply with mental health parity laws and that state regulators hold them accountable?
Well, first of all, we need a statewide plan. California lacks a statewide plan for mental health. By one estimate, only 24 counties out of the 58 in the state have comprehensive services for behavioral health. So the issue of parity, it goes much deeper and broader than just holding accountable the insurance companies, which absolutely must be done. But we need a bottom-up, not just top-down approach to dealing with the issues of brain health. And brain health needs to be put on par with physical health. We need to get serious about treating early so we're not punishing later. I know we all talk about this, and it's not something that's an applause line or it's even something to respond to. It's tragic that the largest mental health facility in the state of California is the LA County Jail. You got 10 times more people nationwide in jail and prisons than you do getting culturally competent, community-based mental health services. I have a little bit of experience with this, doing wellness centers in San Francisco public schools to deal with adolescent mental health. And I'm very proud, and Prop 64, which I helped author, provides hundreds of millions of dollars of additional money for behavioral health services in the state of California.
The question now moves to Antonio Villaraigosa. Would you like me to repeat the question, or?
Yes.
The question is, what would you do as governor to make sure that health insurance companies comply with mental health parity laws and that state regulators hold them accountable?
Well, first of all, I want to thank this union for playing a role. The ACA gave us mental health parity, but it was this union that gave it teeth in terms of timelines for urgent care and non-urgent care. We know that some employers, Kaiser particularly, has been fined millions of dollars because they didn't comply. I think the governor needs to work with the attorney general to make sure that they do comply. We got to fix whatever loopholes exist that allows them not to provide that care. And as governor, I will focus on that. I recognize how important the issue of mental health is. On the streets of Los Angeles, we have the largest homeless population in the United States of America. When you talk to those people, as I have many times, so many of them need that urgent mental health care now. And as governor, I'm going to provide it.
Thank you. John Chiang, I can again repeat the question, or are you good to go?
I'm good to go.
Okay.
As your former state controller, I was the most successful auditor in California history, having identified $9.5 billion in abuse, waste, and fraud. That's because I hold the people that we contract with to accountability and accessibility and transparency standards. I would do that for the state with the state contracts, right? We need pay-for-performance measures with our healthcare providers. We need to make sure that we do more in regards to value-based medicine. We know that those who are trying to profit from the system and not following the rules, not providing the much-needed care that's critical to make sure that we improve the well-being of all Californians needs to be one of our great priorities in regards to the healthcare field. So I would aggressively push. Right, we would identify and make it transparent who is actually performing what services. Are they performing it in an effective manner? Is the state of California paying for it in a timely model and a cost-effective model? And so that we can drive further competition to make sure that we get the best outcomes and performances that we pay with our hard-earned taxpayer dollars.
Thank you. We have 4 minutes for discussion on this. Now, I'm just wondering, does anybody on the panel have a question to throw into the mix on this one? And if not, I, again, do. No? Okay. I'm interested in what, obviously, since you would need to be working with healthcare companies, you've all done a very good job of describing the problem, and in my view, a rather broad promise that something needs to be done, and I'll do that something without specifics at this point. And it's understandable because it's a difficult challenge. But what would be the pitch that you would make to healthcare companies that addressing mental health parity might actually be in their interests, or is it just an impossible job? Whoever would like to take that first can raise his hand or her hand and go first.
I can.
Antonio, sure.
I walked a picket line not so long ago on behalf of hospital workers that were victimized by people with mental health issues, beaten up, and management did absolutely nothing to address their safety. I believe that it's in their interest. Lawsuits will certainly develop as a result of people being beaten to a pulp by people with those mental health issues. So I think it's in their enlightened self-interest to do that.
And let me amplify. I think it's important to talk about new resources. Quite literally, in Proposition 64, we had the counties of LA and San Francisco help draft that section of the initiative that sets aside hundreds of millions of dollars, billions of dollars over the next few decades in new behavioral health and substance abuse dollars, new additional resources. At the end of the day, accountability is absolutely important. But we need more resources. We need more clinicians on the ground. We need more community-based services. And that requires not only resourcefulness as it relates to leadership, but additional resources. And it's an important note to set aside those dollars specifically on a county-based approach to deliver them quality care.
But is there, as your opponents are saying, there's a self-interest argument to be made to the healthcare companies. What is the self-interest argument?
Yeah, no, certainly from a litigation perspective, and there's a moral and ethical argument in addition to an economic argument, absolutely. And there's another argument that single payer would substantially address these issues in a broader perspective. But as it relates to the episodic relationship we currently have with the system. Again, it's about emergency rooms. It's about jail. It's not about crisis management. It's not about treatment. We've got to obviously shift that paradigm more fundamentally. And again, end of the day, this issue of parity, the issue of access, is a bottom-up, county-by-county, community-based solution. And that's the approach we have to bring in terms of ultimately solving this crisis that is becoming more and more acute and, fortunately, more and more topical in this country.
Delaine Eastin.
Would you repeat your question?
My question is, what would, if in the fact is you're going to have to deal with healthcare companies, do you have an appeal to them that mental health parity is actually in their self-interest? Is there an argument to be made to them?
Well, the University of Massachusetts at Amherst suggests that we could save money if we cut administrative overhead and some of the waste that's occurring right now by streamlining delivery. Remember, we're dragging out the time it takes for people to get care. People have very specific, immediate, urgent needs. And so I would argue that the state of California needs to have the same sense of urgency about the care of our citizenry that the
Why should a
shareholders have.
healthcare company listen to that argument? Other than the moral issue, why should they be persuaded by that?
Well, I mean, I think we ought to make it painful for them if they aren't more responsive.
Okay.
They're making money. All right. Thank you.
John Chiang.
I think it depends on who's providing the care and the type of practice. We know that today under President Trump, we have community clinics that are struggling to keep their doors open. 1 in every 7 Californians today goes to a community clinic, principally women, people of color, low-income individuals. They care very much about mental health services because they understand that they have to treat the individual holistically. And so when you have people that are setting the standards, setting the bar as to how healthcare ought to be delivered, right, you can put the moral compunction, you can drive good economic actors, you can drive social activity, social impact, financing to change behavior in the larger market.
Thank you. And that concludes our second round of questions. Now we're going to go back to our journalist panel, and round 3 is going to be led by Bob Butler of KCBS. And Bob, the floor is yours.
Thank you. My first question is for Mr. Newsom. National debate on health care very much center stage in this room all over the country. The Affordable Care Act reduced the uninsured rate in California by half. We've done that by receiving $22 billion from Washington. Right now, it's being threatened. And as the governor, what would you do to save the health care of those people who have it now on the ACA if the president and Congress take it away?
Well, we have to be strong advocates and resist and obviously fight against the repeal, quasi-replace. But that's not good enough. At a certain point, you got to take account. You got to take responsibility. You got to lead. You got to shape the debate. You know, when I was mayor, folks said, boy, it's just too bad the state of California is not providing universal health care. We said, well, that's not a good enough response. We should be encouraging them to do the right thing, but in the absence of that, let us do the right thing. And we sat down with members of your union in its various incarnations and put together the first comprehensive universal health care plan that any city in the United States of America has ever advanced, because we were committed to that process, as I'm committed to the process as your next governor to do the same for the state of California. It's not for lack of resources. We're already investing those resources in the state. It's a question of leadership, a question of commitment. Are you going to hit the ground running? Do you care about this issue? You interested in it? Or are you committed to getting it done? I'm committed to providing universal health care for everybody in the state of California.
Mr. Villaraigosa, staying with health care, there's currently a serious problem. There's a serious problem with hepatitis A, especially in San Diego County. If the state loses the ACA funding, what is your plan to handle epidemics like the opioid crisis and the Hep A outbreak? And I say this as a person who's a recovering addict who knows that telling people just to stop is not going to do it.
Well, as you know, this state has done very little on the opioid crisis. I think last year we lost about 180,000 people. Over the last 10 years, we've lost more people to the opioid crisis than all the people killed in wars since World War II. And so the next governor is going to have to do something about the fact that the opioid crisis, while throughout California, is disproportionately in places where there's not access to health care, disproportionately in places of high poverty and high unemployment. Growing our economy is a good place to start, but as well, we need to put the best minds together, and I certainly will as governor, to address the fact that there have been 3 bills presented in this legislature, and none of them have been good enough. And it seems to me that the governor needs to put together folks to look at this issue and identify what are the most important things we could do on the short term, in the midterm, and long term.
Thank you. Mr. Chiang, given your experience with California's finances, I want to ask you how you would address this following situation. And this is personal. My sister is 65 on Social Security and Medicare and Medi-Cal. Last year, she was diagnosed with stage 4 breast cancer. She was on Social Security, but now with the breast cancer diagnosis, she was given disability, which put her over the federal poverty level. She now must pay a shared cost of up to $900 a month for her care. Last month, she had to choose between paying her rent or going to chemotherapy. She chose her rent. As governor, what would you do to make sure she and others facing this same situation don't have to make such a tough choice?
Yeah, I'm working on that today, actually, in a different field. So I chair CalAble. CalAble is the savings programs for those individuals who have disabilities. And so what we're trying to do in the formation of CalAble is, and to give credit to Jackie Irwin, who was one of the authors of that legislation, and we sent it back for technical amendments, we wanted to make sure that as individuals started to save up to $100,000, that they weren't disqualified from other types of public services to treat other essential needs, right? So the scales, the programs that we're putting in regards to asset calculation to protect them, I would use that as guidance for all our social service programs, because we don't want to put people in harm's way. We don't want people to engage in saving. We don't want people to save, not only for life sets, housing, other types of important things. We want to make sure that we build a scale, not only for health care, but employment, other types of situation, to move people up that they can depend less on public services, but still get what they need to make sure that they can progress in life.
Thank you. Ms. Eastin, I want to turn to one of the biggest threats to organized labor that we've had as far as I can remember. As a member of the Union City Council and the state schools chief, and a member of the UC Regents and the CSU trustees, I imagine you've had some experience with labor unions and negotiations. Yep. As governor, what would your view be on House Resolution 785, the National Right to Work Law, be considered by Congress?
I'm opposed to right-to-work laws. I'm the granddaughter of a teamster, the daughter of a machinist who was the shop steward, the sister of a plumber, and a member of the CFT. So I like to say, you can't scare me, I'm sticking with the union. So I pledge that as governor of California, we will not have right-to-work laws here, and we will use the 10th Amendment of the U.S. Constitution to make sure the state protects our unions in California, no matter what happens with the orange-haired knucklehead.
We have 18 seconds, so.
Well, I'll just say to all of you, I mean, I've never forgotten where I came from. And in my family, we understood that, look, the disaster in America, the decline of the middle class is the decline of the American union movement. We have to stop that.
Follow-up question?
Yeah. I mean, I'm a proud union member for 36 years, a member of SAG-AFTRA. I'm on the national board. We actually call it right to work for less. Yep. We see our members who work in other states who make less money than union members. So this is not just a California problem, it's a national problem. I know as the governor, you can't influence what happens around the country, but what can you do? Because this is, more than half of our states are now right-to-work states. How do we fight that? And I'm gonna open it up.
No, I love this. Oh, forgive me.
Antonio, you haven't had a talk in a while, so you go ahead.
Thank you.
Sure.
And thank you, too.
That was most generous, and I want to commend Gavin Newsom for that.
Could we reclaim the time? They just did.
Well, as I said, I was not only a union member, I was a union organizer, a chief steward, a steward. I fought for agency fee in the 1990s. I know, I've represented unions. I know when people come to your office under the duty of fair representation, you have to represent them, but they don't have to give you money. So I believe in agency fee, and I'll fight the Janus decision no matter what happens, and stand up for the notion, as Delaine said, that we'll take a page out of Texas' book. Texas used the 10th Amendment to fight virtually everything that President Obama did, and we'll do the same with President Trump.
We're referring to that as progressive federalism, and I submit to that point of view as well. No, look, I think this is I don't think it's ever been more challenging. You fast forward a year from now, and what's coming down the pike as it relates to the right-to-work legislation, what's happening at the NLRB and anti-labor appointments, what's going to happen likely, sadly, with the Janus decision, you're going to need a champion. You're not going to need someone who's going to be with you, but someone who's going to be out front fighting for you every single day. This is a profoundly significant issue, the fate and future, as you say, Delaine, of the middle class and how that is inextricably linked to the success of your unions and the work you're doing every single day to collectively bargain for the fate and future of your families and for people not even part of your union.
Mr. Chiang.
So I, too, was a union member. When I graduated from Georgetown University Law Center, went to work for the Internal Revenue Service, I was a member of the National Treasury Employees Union. Who belongs to that union? Hey, I'm not waiting for the right-to-work legislation to pass. I'm taking action today. Some of you have followed at CalPERS and CalSTRS. I'm leading the effort for labor neutrality on collective bargaining agreements. When you have the biggest, most powerful interests in the United States of America across the world trying to stop workers from exercising their rights, I want to make sure that we who invest in these corporations stand up too and say that's wrong, right? We want to encourage individuals to have the ability to negotiate for their salaries, to negotiate for their working conditions, to negotiate how they serve patients, how they serve the greater audience of the world. So I am taking action today. I am not waiting.
What do you think you're going? Bob, you're doing a great job at this. If you want to keep going.
Well, I mean, this is such an issue that's so near and dear to my heart, and I imagine all of you in this room, if you're a union member, you know that right to work is a serious threat. But maybe we can go across the street and talk to our colleagues over there about this issue, because it seems to me that this can't just be a Democratic issue. I mean, we've got to get the other party to see that this is a serious threat. And I don't understand.
But one note is, I think you're being union guy now, not journalist guy. So.
You're right. You know what? And sometimes it's hard. But as a journalist, how do you get the other party to see how much damage this has done to the middle class?
That's a great question.
Yeah. I mean, I think at the end of the day, you can't live a good life in an unjust society. There's no leak on your side of our boat. You know, if you want to go fast, you can go alone. You want to go far, as a state and a country, got to go together. And so this notion of interdependence, I say to my business friends all the time, your business cannot thrive in a world that's failing. And unless we deal with the issues of social mobility, income inequality, wealth inequality in a meaningful way. Look, we live in the richest and the poorest state in America. 8 million people are below the poverty line, 24% in the supplemental poverty index of our children living below the poverty line. These issues are relevant. These issues are related. And with respect to the Republicans in this state, the 26 counties that went for Donald Trump, look at the concentration of poverty in those counties. Look at the counties that are not being represented, that could be represented by working folks that are organized in unions like yours, whose wages and prosperity could be substantially improved and increased. Labor is the key to the middle class. It's a key to so many of the challenges we face today.
Antonio, I can give you last word on this, actually.
Well, labor is the key, and that's why I worked in labor for 15 years before I got elected, and why I worked with them when I was Speaker of the Assembly, when I was Mayor of Los Angeles. I do think we have to bring Democrats and Republicans together around the notion that we got to grow this economy, that we got to grow middle-class jobs. I think you're absolutely right, Gavin, when you look at the state, you see disproportionately the places that are right to work are places where people work for nothing.
Okay, I have to stop you there. And that concludes this round of questioning.
James Logan won last night, 52-0.
I'd like to just say that 50% of the millennials identify as working class. they have a much smaller chance, they're best well-educated, they have a much smaller chance of entering they identify as working class, they have a much smaller chance of identifying and entering the middle class than their parents did. The truth is the millennials are eager to unite with labor. We need to identify ourselves with them and turn everybody, whether they're Democratic or Republican, into believers that California can be a better place, but especially if people have a living wage, and that's about reviving the labor movement in the state of California.
Okay, I have to. Delaine, you know, I was looking for a period where I could stop you. That was the longest sentence. With commas and semicolons and subclauses. It was brilliantly constructed. We're going to move on to round 4. This is, again, is a question from a member of the National Union of Healthcare Workers. It's from Alex Sanchez. She is an ultrasound technologist in Napa, and she says, I work at Queen of the Valley Medical Center. She says that our hospital has violated labor laws and refused to recognize the results of a union election for more than 400 employees. She says right now there's a court injunction against the hospital while a new state law attempts to curb similar violations of employees' rights by car makers. This is important. She's drawing a parallel to a new state law attempts to curb violations of employees' rights by car makers. She is asking, can such a law be constructed for healthcare workers? Do you support the legislation on car makers? Second, would you work with us to develop similar legislation requiring hospitals to treat their workers fairly in order to qualify for state subsidies? Again, on the electric car, on the car makers, to get rebates, they have to be certified as fair and responsible in the treatment of workers. So the question is, would a parallel first of all, you support that law for, did you support that law for car makers? Would you support similar legislation for healthcare workers? And that question is going first to Antonia Villaraigosa.
I wasn't in the legislature and wasn't asked about the law, but I would support that law. And I would support a law that requires the same of hospitals. I mean, this is in the interest, you talked earlier about the enlightened self-interest of a company. This should be in the enlightened self-interest of healthcare providers, that they're providing that healthcare in an appropriate way, that they're allowing their employees to organize in a country and a state where you have the right to organize and collectively bargain. When you've won an election, you ought to have the results that come with winning that election. And yes, I would support both pieces of legislation.
Thank you. John Chiang.
Yeah, I would hold the hospitals and healthcare providers accountable. I've been in the middle of negotiations where I bring people together to have discussions about how we negotiate differences, and when you identify violations, making sure that both parties identified and that they call it straight. Not only in this particular regard, but when I served on the Board of Equalization and Controller, many of you understand that there's questions about hospitals and the amount of charitable care that they provide. When I get there, I want to make sure that we provide clear definitions so that if you can get subsidized by the state or other types of entities, you're actually providing the care that's promised to the individual. So yes, I would hold the hospitals accountable. And so not only on that particular regard, but also, as I mentioned, on the financial positions.
And John, did you support the legislation in regard to automakers?
I serve as state treasurer, so it doesn't come before me, but I do support it.
You know, I mean, in principle,
Yes.
Did you support it? Okay, thank you. And the question now moves to Delaine Eastin.
Well, I mean, obviously, I support both pieces of legislation. This is a right that workers in California need to have. And I wouldn't just sit in the office and say we're for them quietly. I would be out there marching as the governor, marching with the union to say this hospital has to play by the rules. That's who we are. We play by the rules. They had a vote. They voted overwhelmingly to be unionized, and by God, the hospital ought to have to negotiate with them. It's really time, yeah. And I will just say to all of you, you know, I know what it's like to be in a union family when it goes on strike. I know what it's like to live pretty close to the vest in terms of finances. Thank God for American labor, but we have to grow American labor because there are way too many people right now living on the margins because we're not paying a living wage. I stand with you. I always have. I always will. Check my record.
I think we're all on the same page as it relates to the legislation and the sentiments. And it really underscores a fundamental point about the world we're living in. You can't be passive anymore. You can't wait for, I mean, as a governor, you can't wait for things to land on your desk. You can't wait for labor issues to work themselves out. You need to shape things. I mean, there's an old adage, right? The future's not in front of you, it's inside of you. You got to manifest it. Few unions understand that better than you. You got to make it so. It's right decisions. And so what you need is the kind of support and advocacy of people with that experience, that background, to shape solutions to these vexing problems. And I'm committed to being that person. I also am committed to helping the folks up in Napa recover, and the folks up in Sonoma recover from these fires. I had the privilege and burden of being up there for 3 days. It is jaw-dropping, and the challenges up there are now even made more acute, not just at the hospital, but for an entire community and a workforce that have been displaced from their homes and don't have any real
Gavin,
confidence they can get back.
that's off point. I just need to point out.
Respectfully, the fires, I think, directly impacted the hospital, and so substantively, I think it's
All right, that's a nice
consideration.
pivot, but I want to point out that it's a pivot.
If you were up there, I mean it.
I'm not disputing us there, but
it's very heartfelt.
Just in terms of
Actually,
keeping things on
in
topic here.
In fairness to him, you did say the person was from Napa.
Oh, okay. I back off. When a point is scored against the moderator, the moderator must admit that was a well-scored point, and you were well within your. So
warned nonetheless. I get it.
You got quite a wingman. I want to take to the point we were just discussing. It seems like there's virtually no daylight between the four of you on the topic that we just discussed. But Bob Butler mentioned before, how do you persuade the people across the street? But the concept of the question of embedding in law penalties for private enterprises if they don't abide by make concessions and embed them in law that support labor. As you know, it's very popular in this room, but it would be abhorrent to many in the private sector. Not all, but many in the private sector. And my question is, do you need at all to change minds on that? Or do you just need to get the votes to get it through and force it through? Or do you actually think there's a process of trying to change minds on that?
Part of leading is changing the minds on that. I think we've talked, a number of us have talked about the enlightened self-interest of employers in the private sector, in this case specifically around healthcare, of providing for the right to organize collective bargaining. But importantly, this union hasn't just been about wages and and the like and pensions. They've been about patient care, protecting patient care. They've been on the front lines of making mental health parity a reality and not just a vision statement. And so I do think you have to convince people of doing that, using a carrot and a stick. And I do believe you're right, that as much as possible, you need to bring people together around the notion that this is in everybody's interest.
John Chiang, do you think that's a doable thing, especially in the climate we're living in today?
Yeah, absolutely. The corporate boards, corporations aren't homogenous, right? When I engage in negotiations, trying to bring the parties together, I will find differences amongst the members of the leadership for major hospital entities, for major businesses. Something else that Bob referenced, I want to take a different tack is how do we address. Since I've been a CalPERS CalSTRS board member, I've aggressively worked to change the faces of private sector leadership, right? So we have to make sure that corporate boards understand the conditions that people work in, that they represent the diverse communities. So in my second year in office as the state controller, I pushed for more people of color on corporate boards, right? This is an international world. When you think about California, 40% Latino, 38% Caucasian, 16% Asian, 6% 6.5% African American, and the rest of the United States of America. This is an incredibly diverse country, very diverse state. I push for more women on corporate boards. I push for more members of the LGBTIQ community representatives on corporate boards. I push for more people with climate change expertise. So not only does it have to emanate from public rule, public policy, we need moral and business leadership that are going to push forward these changes in policies.
And Delaine, Delaine, I'm particularly interested to hear how you answer this question in terms of wanting to persuade and win over people who don't hold the view. Because earlier you got an applause line with let's make them hurt, and that would work. But this is a different dynamic. Can you persuade people to come over to your side, or is it a lost cause?
No, I think we can persuade people to come over our side, but you heard the line, fish stinks from the head. We really need leaders in this state to actually profile the real issues that are facing California. When I was superintendent of public instruction for the state, I challenged the governor to reduce class size in kindergarten through third grade. That was my concept. Because I'd gone from a classroom in San Francisco, a public school with 44 kids, down to San Carlos where I was the 20th kid. Teacher in San Francisco was good. The one in San Carlos was good, but one had 44 and one had 20. Duh. So at the end of the day, when Pete Wilson wouldn't go along, I sued him. And we won the lawsuit. And we did class size reduction in kindergarten through third grade.
So how are you telling me that you can persuade? How is this telling me that you can persuade people?
You try to persuade people, and if you don't persuade them, you sue them if you have to.
Okay.
You do what you have to do to get the job done.
Gavin Newsom, let's take the question to you.
It's hard to follow that. But no, look, I think it's not lost on any of us standing up here that we're in the midst.
And let's not bail on this one. I want to give Gavin time.
No, I'll be brief. But most folks in this room, look, you get this, and I think it's back to this notion of enlightened self-interest as it relates to hospitals and it relates to the private sector to work collaboratively and to give workers a voice, and that's what your union's about. And look, the power of emulation. The most successful models integrate workers' voices. Integrate a framework of kind of collaboration and partnership that ultimately allows the private sector to thrive, higher productivity, better workforce satisfaction. Those are the most successful business models. And so from a persuasion, and that's your question, from a prospect of persuasion, you have to share those examples and offer those up as alternatives to not treating workers fairly and not treating unions in a respectful or legal manner. And final point, when it comes to public money, absolutely we have the right to inject accountability and hold folks accountable. And when it comes to health care, there's no greater form of public subsidy than the issue of health insurance.
Thank you. That concludes our fourth round of questions. Now we're on to round 5, and here is from Telemundo, national correspondent for the network, Maria Paula Ochoa.
Thank you. Thank you, everybody, for allowing me to be here. So my first question is going to be for Mr. Villaraigosa. Mr. Villaraigosa, on October 4th, Governor Brown signed a landmark piece of legislation declaring California a sanctuary state. The federal government promptly retaliated by announcing they will begin conducting workplace raids. How will you protect our residents from such actions and from other retaliations such as threats to funding for our law enforcement?
Well, first of all, sanctuary state started in Los Angeles in 1978. It was Special Order 40. It started with the notion that job number one for our police officers, our public safety professionals, is to protect the public safety, not to enforce our immigration laws. Immigrants were being victimized and wouldn't cooperate with the police department, wouldn't testify in cases, and so the police chief, a very conservative police chief, by the way, Daryl Gates, decided that he would move ahead. I support the bill signed by the governor, the sanctuary state bill. I know this is a sanctuary union who's going to stand up for people in your hospitals to provide the care. I said earlier, I'm going to work with the Attorney General to make sure that we're doing everything we can under the law to protect these people. I think we got to expand the legal aid efforts that we passed and do other things as well.
Thank you.
Thank you.
Thank you.
Okay, Mr. Chiang. Agriculture is one of California's leading industries, and it relies on low-skilled but hard immigrant labor. The current administration's solution for immigration reform, the RAISE Act, is a merit-based program which does not provide for those low-skilled laborers. What would you like to see in an immigration plan that would provide for these much-needed laborers?
Yeah, I think it's crystal clear that we can't change policies midstream, even though it's been a while. We brought a lot of braceros into this country in 1941 when we entered war, where the agricultural workforce went to work in manufacturing, building the military equipment to protect this country. So we welcome Mexicans and other immigrants to serve on our lands. And so suddenly, after we use them for our economic purposes, we say, you're no longer of value. That's not what America's about. My parents were immigrants who came to this country with very little. My dad, 3 shirts, 2 pairs of pants, less than $100 in his pocket. That's the American story, right? When you have good, well-intended people who are trying to make this country better, who aspire, who are community participants, we have to fight for those individuals. And also in the Central Valley, we can bring both Republicans and Democrats to this table. As I talk to some of the more conservative farm owners, when I talk about those who are serving, they understand and they're trying to reach out to their members of Congress. We have to make sure that we create national support, reaching across the aisle to Republican governors and others who are touched by this, to aggregate, to work collectively to change policies.
Thank you, John.
Thank you. So this question is for Ms. Eastin. Ms. Eastin, how will you use the power of the governor's office to advance the rights of immigrants and their families beyond the borders of California, in essence, nationwide?
I believe very strongly in the importance of the immigrants in the state of California. Right now, we have a farm worker shortage in agriculture. And so let's get our heads screwed on straight here and understand virtually every person in this room is descended from immigrants. We are a state of immigrants, a nation of immigrants, and we must stand with the immigrants, period. I will also say, though,
But the question is, how would you use your role as governor to advance the rights of immigrants nationwide?
well, first, you should know I opposed Proposition 187, 209, and 227. And when Pete Wilson challenged me on those, he challenged me the day after I got elected to issue a direction as soon as I was sworn in to have the teachers of California be immigration and naturalization cops.
Okay,
I said I wouldn't do it.
I'm sorry, it's still
I will
not,
stand up to any president.
Okay.
I will stand with the state of California on behalf of the people who live here as a sanctuary state.
Thank you.
Mr. Newsom, this year the state allocated some $60 million in funding for immigrant support services and financial aid for DACA students. Will you as governor commit to repeating this investment or even increasing it, and why?
The answer is yes, for the same reasons the sentiment was expressed here. We're a majority-minority state. What makes this state great today is that at our best, we don't tolerate that diversity. At our best, we celebrate that diversity. It is incumbent upon the next governor to lead the national debate on immigration reform. You know, 5 years ago, we had to sit back and watch Jan Brewer and Rick Perry lead states in the national immigration reform debate. California has been demonstrable in its effort to radically change the way it produces and consumes energy. We've led the way in terms of climate change. We have the opportunity to shape, along the same lines, the national debate on immigration reform. We have more at stake in this state than any other state in the nation. We have more dreamers in this state. We have more immigrants in this state. We have more undocumented residents in this state. And yes, we have a new drought in California, and that's a drought of farm workers. And it is an interesting point. John and Delaine are right, that Republicans, not just Democrats, are finally joining this debate. What makes California great is we practice pluralism, and I'm proud of our state for doing that.
Do you have a follow-up?
So how will you, and this is for everybody, how will you plan to defeat the federal government when they are threatening to come and get after the immigrants in California because we are a sanctuary state, and also in the fields? They are adjusting this RAISE Act, which I'm so sorry, but my English sometimes gets stuck. In this RAISE Act, they're going to leave behind people like the farm workers. So should the federal state come and make those laws actually factual, how are we going to defeat that economically, you know, in other senses?
Antonio,
Well,
can you take that
all,
first, please?
Yeah, first of all, you know, at this time of anti-immigrant and anti-Mexican hysteria, who better to lead a national debate than a governor named Villaraigosa? And in that regard, I've been doing this my whole life. I'm not Johnny come lately to this fight. And so what would we do specifically on this issue? I said earlier, we're going to use the law, the 10th Amendment, and every law we can to protect these people. We're going to expand scholarships for these young people in our colleges. We're going to stand for the notion, when I'm governor, that you need a specific warrant to go into a hospital, a school, a courthouse, an unemployment office, anywhere where these agents come to round up these people. Let's be clear. We have a broken immigration system. Democrats and Republicans agree. Let's fix the broken immigration system. 11 million people deported, really? No country's ever done that. And it seems to me that the next governor's got to stand up for the notion, lead the way, say that we've got to reform our immigration system, and not just for agricultural workers, for the dreamers, for their parents and their families, for every one of them.
Maria, do you feel that that answer was responsive to your question?
Well, yeah, that's very nice to say, but my concern, and I assume everybody's concern, is if the federal government comes and imposes their federal laws into the state, how can the state defeat those laws and still defend the immigrants?
Through the courts. Just, everybody, we thought.
Antonio, I'll give you 30 more seconds because I want to hear from everybody else.
Through the courts. And we're going to aggressively use that 10th Amendment that was mentioned earlier. We're going to stand up for the notion that we're going to drag this out. Every one of those laws, we've already seen it with respect to the ban. And I've stood up for the notion, no ban, no wall. But we've already seen with respect to the ban, every time they do a new iteration, it gets defeated in the courts. Okay. We're going to prolong this,
John,
over the years.
I'm sorry, Antonio. This is personal. I have Brenda on my staff who's a dreamer, right? She's graduated from UCLA. She just got married on Friday, really passionate. I live that example of hiring people who can achieve, right? So I'm going to bring together people not only throughout the United States of America, right? We know that this impacts people from other countries. I want their international goodwill. I want the international morality argument. I want their international economic argument pushing back against what they're trying to do in Washington, D.C., in addition to what Antonio was saying in regards to pursuing all legal avenues to make sure that we make it difficult, that we protect the constitutional freedoms of Americans and others in the United States of America.
Okay, I'd like to go to Gavin and then give Delaine the last word on this.
No, I agree with the sentiments of Antonio and John, but let me amplify them a little bit. By taking the core principles of our sanctuary policy, we can choose not to collaborate. We can choose to advance sanctuary status, not just with unions, not just at the state, but our campus level. I got in a bit of a debate with my colleagues on the UC regions. They didn't want to use the word sanctuary. I think words matter. I know it's a loaded term, but I think words matter. The CSU, accordingly, decided not to use the words. Reality, at the end of the day, sanctuary policy, as Antonio said, by the way, came in LA and San Francisco around the same time.
Gavin, can I stop you just a second? I just want to, do you feel your question's being answered? What will California, and maybe it is, but I just want to be clear.
Yes, yeah, no, it is being answered.
Okay, go continue then.
So the principles no, it's good, John. It's good, but the sanctuary policy is the reason we did the sanctuary policy was an effort to answer that question.
Okay.
What can the state do outside of the courts to advance these principles and to protect workers, to protect folks in clinics, to protect people? It's our schools, to protect people in our diverse communities. And it's important to note, sanctuary policy works. It keeps people safer. Sanctuary cities and counties are safer than non-sanctuary cities and counties. It keeps people healthier for obvious reasons, that people are not, as they're getting an immunization shot, they're not going to be as worried about someone coordinating and collaborating with federal deportation forces. You're more likely to pick up your kids or drop them off at school and make sure they're educated with sanctuary policy. And from a criminal justice perspective, you're certainly more likely as a victim of crime to participate with law enforcement to hold folks accountable. Sanctuary policy was principled in the cities. Now we've advanced it into the state, and fundamentally this is a point of pride that the state of California has asserted itself in this debate, and we need to push back and continue to build on the policy as the governor
for
decided.
time, I want to give Delaine the last word on this. Let's not bell this. Let's because she hasn't had a fair shot at this. Go ahead, Delaine.
Well, I have said, and over the last course of this campaign, that the 10th Amendment to the Constitution been waved in our face by Republicans for decades. And it's time for us to wave back and say, we stand with the Dreamers, we stand with DACA, we stand with Californians who live here as Californians. And we, by God, will go to court if we have to. We'll go to preventing the federal government from invading the rights of the people who live in California. I marched with DACA from City Hall in Sacramento to Homeland Security building. I stand with DACA. I always have. I always will. We have a responsibility. The people who live here, they're our neighbors. They're our friends. They're, yes, our employees and our colleagues and employers, by God. And I want to see them treated with the same respect that everybody in this room wants to be treated with and more.
Thank you. And that concludes round 5. Round 6, we have another question from an NUHW member. This is from Maria Martinez. She is a nursing assistant in Marin County, and she says, I work at a chronically understaffed nursing home. She works for Bria's Healthcare. She writes that the company's patient care violations are well documented, that its CEO was called a serial violator by the state attorney general, that the Department of Public Health has blocked Bria's from obtaining a permanent license to operate 5 more nursing homes. But despite this, it is still operating nursing homes through provisional licenses. Here is the question, and it doesn't have to be, and should not be Bria specific, actually, because that's not the point. But as governor, what would you do to ensure that companies committing violations cannot buy up more nursing homes, and that when conditions get bad enough, chains are stopped from doing business in our state? And that question goes to Delaine Eastin first. I'll repeat it. What do you do to ensure that companies committing violations cannot get more nursing homes, and that when conditions are bad enough, they are stopped from doing business in California?
As governor of California, I will join shoulder to shoulder with the Attorney General of this state to ensure that the laws of California are followed. Look, I have a 97-year-old aunt who's in a nursing home, and I know, in fact, that she's getting very good care because we all hang out there. But at the end of the day, I've also met people whose parents and grandparents are in abysmal situations. It is unacceptable for the state of California not to be nimble as can be. Of course, you shouldn't be allowed to open more nursing homes if you have violations of the ones you currently operate. The problem with common sense, Mark Twain says, it's not very common. So let's apply a little common sense here. Yes, we need more nursing homes, but they need to be wonderful places where people want to be, where there's engagement and interest and an opportunity for safety and health. We can do this, and we can put a lot of people to work, and we can improve the wages and the conditions together if we have an attitude that these people are our friends, our neighbors, and our fellow citizens.
Thank you. Gavin Newsom.
Yeah, I mean, one way to do it is continue the unionization efforts around the nursing homes to improve conditions, which I think is front and center in this debate. Look, it's all about accountability. It's all about transparency and making sure, look, if there's a bad actor, you got to call that out. And you obviously don't want to replicate those kinds of conditions in subsequent investments. That's common sense. But let me just, if I may, and this is not getting off topic, I think it's quite on topic. We've got a crisis in this state no one was talking about, and that is this silver tsunami. We've got an aging and ingrained population. The issue of nursing home and care is got to be front and center in our debate. And we're not talking enough about the fact that you're going to see in the next 10 years a 78% increase in the number of people 65 and over. We're actually going to see a modest decline in the number of young people over the course of the next decade. We have an LVN shortage issue, an RN shortage issue. We're almost bedlocked as it relates to providing skilled nursing facilities and these kinds of more broad care environments. And I think it's incumbent upon us to put together some strategic thinking along these lines and make sure that we're there for our seniors who have done so much for the state.
Antonio Villaraigosa.
Well, I'm part of that silver tsunami.
I just wonder, we've wandered already. I want to remind you of what the question is. When conditions get bad enough, what, as governor, can you do to make sure that they don't get business in our state?
Yeah, I wrote it down. Thank you.
Good. Thank you.
As I said, I'm part of that silver tsunami, and I think Gavin's absolutely right. It's here. It's coming, and we've got to do something about it. And I am prepared as governor when you think about it, The responsibility for elderly care is the responsibility of families and government. So if someone in the private sector is making money off of that, at a minimum, we have every right and responsibility to say, you have to be a responsible actor. You have to provide that care in a quality way. You have to ensure that your employees are treated well. And so as governor, I won't allow them to expand. Habitual violators will not be allowed. I'll work with the legislature to ensure that we have laws that can, with teeth, by the way, and work with your union to do the same, to make sure that they don't get away with that with murder.
So your answer to the question is you would pursue legislation to give.
Well, I think that's what you'd have to do.
Okay, thanks.
You couldn't do it by edict.
Yeah, but I think that's the kind of concrete answer that the questioner and the union member was looking for. Let me take it to John Chiang, the same question.
Yeah, sort of referencing the questions from earlier on, I would hold them financially accountable. You have to measure whether they're performing, and if they're not performing, you have to make sure that you start pulling away pay. I'm also aggressively going to make sure that we push transparency. You know, how are these centers, how are these different healthcare providers performing? We want metrics that are clear. What we don't have in the healthcare market is the ability for individuals to measure the performance that's being delivered, what type of services, and how much they're being reimbursed. So I think we can change it through law. We can change it also through market opportunities. What I also would do, taking from tax principles, is if you have bad actors, we want to make sure we identify those bad actors so they can't create subsequent companies, right? We want to make sure that they correct past incorrect behavior so that, and before they want to go out and start new businesses in that same line of field, that they can't engage and evade their past misbehavior. They have to fix it before going forward.
All right, thank you. I'd like to just pass the question one more time by Delaine and Gavin, because I think it wasn't until we heard from Antonio that we really got specific about what would you do as governor to keep these chains from operating. So Delaine, can you take 30 seconds just to address that question? And it's fine if you say that, you know, you reference I would do the same as your partners, but I just want to get a sense of where you would stand on that.
Yes, first, work with the Attorney General to prosecute the people that are not following current state law with violations. Second, sponsor legislation that makes sure that these people cannot open other facilities when they aren't maintaining the ones they've got. This is common sense. And third, be more supportive of those agencies that do the oversight, because in fact we need to do that. I will also say finally, yes, we need to build the union movement even stronger among healthcare providers in the state of California.
By the way, there are a lot of laws on the books. It's a question of enforcing the laws on the books and making sure that the folks that are appointed to these positions of oversight are doing their job, which is another executive function. So, you know, we could pass some new laws. And by the way, I'm open to argument in terms of areas where we can improve some of the existing laws. But Delaine's right. I mean, it's all about accountability with the Attorney General's office, but also accountability as it relates to our public agencies to make sure that they're doing their job at a grassroots level, and we're calling out the use and misuse of public money.
Let's take a few more minutes then on the point you just made. The laws, Gavin, you're saying the laws are there, they're just at this point not adequately enforced. I want to take that down the panel. Why do you agree with that assessment? And if you do, I'm curious to hear, Antonio, why you think they're not being enforced.
I'll be truthful. I don't know if the laws are currently in effect to allow you to do that. What I'm committed to is to making sure that we do have those laws, and so that's my answer.
What about you, John? The question being, to take Gavin's point, that the laws, there are lots of laws, he said, and the question is, are they being enforced? And his point being, number one, there are lots of laws, and no, they're not being adequately enforced. What about that? Why would that be the case, and what do you do about it?
Yeah, so the answer is I don't know, but I participated in underground economy seminars when I was the Board of Equalization and State Controller, so I would bring those various agencies together to have those discussions. It's been written about, but in my leadership, I've created interested parties meetings, so I would bring in this union and others to see which laws are being enforced and which laws are not being enforced, have them meet with the appropriate personnel within state government to make sure that we're pursuing the full spirit and letter of the law.
Delaine, Eastin.
When I took over the Department of Education, it was a mess. There were people on IBM computers and Apple computers couldn't even email each other. We had people retired on the job. There was a lot of immoral behavior, but also a lot of demoralized people. So I brought in the most diverse leadership in the history of the department, and in fact, we moved the needle dramatically for children and education. We streamlined bureaucratic procedures. We put people on a mission, and I still have people come up to me and say those were the best 8 years I served in the state government because everybody was on a mission. We need to make sure that those agencies that do the oversight over your hospitals and your nursing homes have people on fire to do the right things for all of you, but especially for all those patients that are not getting the kind of care they deserve in California.
And why is it not happening?
Well, I really do think that there are some agencies of the state government that are not very nimble right now because the people are demoralized. We need to get people on their toes again. People need to be on a mission. Government of the people, by the people, for the people. And that's not happening in too many agencies in California.
And Gavin, this line of questioning started with you.
Yeah.
Why do you think that the laws aren't being enforced?
There are a lot of people who have different opinions on that, including folks that are on these oversight bodies that frankly have the industry's interest at heart, not necessarily the workforce or the patient's interest at heart. But look, at the end of the day, I mean, the best answer really is a unionized workforce where workers have a voice and workers are front and center calling these things out and then supporting the efforts of unions like yours in advancing litigation to the extent that that's the course of action or the recourse to actually solve problems. It's unfortunate so often you're on your own, sitting there wondering where the heck the state is, financing these legal actions, forcing those employers eventually to mitigate those issues, and you sit there bewildered, saying where's the local government, where's the state government, and where's the federal government that also has a role to play in terms of that. So it's, again, a question. I know it's a cheap answer, but it's a really important answer, and that is it's a question of leadership. It's a question of commitment. It's a question of willingness to engage in these issues, to have two-way conversation, and to make sure that we don't wait till things fester and we don't wait till problems become acute.
Thank you. And that concludes round 6 of our questions. And now we are heading down the home stretch. Here is Jeff Horseman. He is political reporter for the Register Press Enterprise and Southern California News Group. Jeff, the floor is yours.
Good morning. We spent a lot of time talking about healthcare and healthcare costs, and rightfully so, but I want to talk for a little bit about other cost of living concerns in California. According to a September 2017 report from the Public Policy Institute of California, home ownership in the state is the lowest it's been since the 1940s, and 1 in 3 renter households spends at least half their income on rent. In addition, California's gas prices are traditionally among the highest in the nation. 57% of those polled in a December 2016 PPIC survey said higher education affordability is a big problem. And finally, 4 in 10 Californians are living in or near poverty, according to a PPIC report from October 2017. Mr. Newsom, aside from the cost of health care, what do you see as the most pressing issue when it comes to California's cost of living, and how, if elected governor, would you address it?
Well, I think housing's the quickest answer, but it's also child care and extends beyond the cost of college and issues of gas. Look, affordability, if there's one word that defines at least my year out in this campaign trail, it's the word affordability. And at the end of the day, when people are spending, we're 49th out of 50th in the nation in per capita housing units. By one estimate, we're 3.5 million housing units short of where we need to be to really get the cost curve down in the state, and that has to be delivered by 2025. So the issue of cost of rent, cost of housing, it's clearly a coastal issue, but it's also an inland issue, has to be tamed. And at the end of the day, we're not going to have 20 seconds to answer a housing question, but it is going to require leadership from the top, but at the end of the day, localism is determinative. We have got to focus on land use fiscalization. We've got to focus on making sure we get that affordable housing bond passed, make sure that we continue to look at novel efforts around creating successor agencies to our redevelopment agencies with infrastructure financing districts, and many other things that I'm looking forward to talking about in the 4-minute wrap-up of this session.
Thank you.
Mr. Villaraigosa, I pose the same question from you. Aside from the cost of health care, what do you see as the most pressing issue when it comes to California's cost of living, and how, if elected governor, would you address it?
I think the most pressing issue facing this state is the issue of two Californias. We live in a great state, sixth largest economy in the world, with the highest effective poverty rate in the United States of America. Democrats have forgotten what it means to fight to grow our economy, grow more middle-class jobs. And I believe that the next governor is going to have to focus on that, educate the kids that we need from early child education, universal preschool, all the way to college affordability. Train people for the jobs of the 21st century, including jobs in healthcare with the silver tsunami that we heard a few minutes ago. The next governor is going to have to do a lot more about poverty. The housing crisis. The reason why we have the highest effective poverty rate is because people are making money, but housing costs too much. And particularly on the coast. So I believe the next governor's got to focus a lot more on that issue of one California.
Mr. Chun, the same question. Aside from the cost of health care, what do you see as the most pressing issue when it comes to California's cost of living, and how, if elected governor, would you address it?
So I've been working on, for the last 19 years, because I'm the only person to serve in all three financial offices, number one, housing. It was my top priority statement, and when I became this treasurer of the state of California. Over the last 2 3/4 years, I've effectively, through TCAC and SIDLAC, those are the tax credit authorities for California, increased financing for new and rehabilitated housing by 80%. We can't keep driving more people into poverty. We have to make sure that we build more housing throughout the state. I had a bill that Senator Ben Allen carried. As governor, I would get it through the legislature and sign it to reduce the cost of student loans. We know that individuals who graduate are carrying massive student loans. They can't buy housing, right? They can't save for money. I want to make sure that we get through. And then I want to make sure that we get every single penny you're entitled to into your pocket. I think I was the first statewide elected official to do free income taxes at the Board of Equalization as controller, right? When I ran for controller, we had Intuit put $1 million in support of my opponent because they don't want me to use technology to make that technology available for all.
Thank you, John Chiang.
Finally, Ms. Eastin, the same question. Aside from the cost of health care, what do you see as the most pressing issue when it comes to California's cost of living, and how, if elected governor, would you address it?
The biggest issue, I think, has to be education. Ladies and gentlemen, we had a big recession, and Arnold Schwarzenegger took 20% of the cuts out of child development, which was only 3% of the state budget. All that money has still not been restored. We have over 600,000 parents on waiting lists to put their kids in child development. The reality is we need to have preschool universally available. We need to have mandatory full-day kindergarten. We need to move from 41st of the 50 states in per pupil spending back to the top 10. We're number 1 in per prisoner and number 41 in per pupil. That is not acceptable. Then we need to build colleges and universities in the state of California, especially in rural, remote parts of the state where many of our kids can't go to college because it's too far. But beyond that, we need to be on fire about education. And if we give kids a great education, they'll have great jobs and they'll pay great taxes and they'll give back to California and we'll be able to afford all the other things we need to do. But education should be number 1. The state constitution says so.
Paula?
Yeah, Ms. Eastin, you talked about education, but the argument can be made that if you give people this, you give people the skills and the education that they need, if the jobs aren't available, then it's kind of a wash. Can you talk a little bit about, in addition to wanting to spend more on education, efforts that can be made to bring those type of jobs so that when people get the education to do those high-tech, high-paying jobs or those highly skilled jobs, how do you address the jobs equation end of it?
Well, let me just say, when I graduated from high school, we were 5th of the 50 states in per pupil spending, and the Silicon Valley was born here. It wasn't because we had a confluence of rivers. We have no Tigris and Euphrates. It was a confluence of great educational opportunities that created the Silicon Valley. We can do this again in California, but only if we really focus on the education of all of our children. Right now, there's an exact overlap between student achievement and child poverty. We have to invest more, especially in the poorest communities of California. It is our sacred duty. Article 16, Section 8 of the state constitution says, from all revenues there shall first be set aside the monies for the education of children through institutions of higher education. That is not what is happening in Sacramento today. the kids are sort of getting whatever's left. And the truth is, yes, I'm for bringing back redevelopment and spending more money on affordable housing, but you have to have educated people in order to be able to create the jobs that may allow people to buy the houses, to live in the house that Jack built.
Thank you very much. John, do you have any more follow-ups you want to do?
I'd like to hear some more specifics from Mr. Newsom about, you mentioned kind of some of the things you like to do to...
He also admitted he was out of time, and I respected him for stopping,
okay.
so take some more time.
On the housing, and if I may, with your indulgence, talk a little bit about the jobs question that you just offered, because I think it's profoundly significant. Look, in addition to, by the way, a big part of any housing question is dealing with renter protection as well, which is something we need to advance as a principle in this state. But the jobs thing, I think, is profoundly important. The number one job for American men in the United States of America is driving. You got 3.5 million truck drivers that are in peril of being out of work in the next decade with these driverless trucks. We've got an automated economy now that is coming our way, and we need to prepare for that. And it requires a completely different thinking. Look, as a mayor that did universal preschool, it's important to front-load education, absolutely. But it's also essential to backload education. And it's about that skills gap. And it's about lifelong learning. Education begins when you graduate in many respects. And so we have to have a different paradigm and a different framework to address this growing skills gap and to address the growing underemployment that exists in this state and this nation. Technology and automation detonating at the same time. This is a profoundly important issue, and it requires a different kind of economic development and workforce development strategy.
Antonio.
I'm ready to answer your specific question regarding what else we need to do around housing. First of all, we need to put that housing trust, the housing bond that we pass going forward every other year, a housing bond that's big enough. We need to put that in a housing trust fund that can leverage tax credits, that will reward cities and counties that are putting up their own money, that will reward cities that are shortening the approval process, that will acknowledge that if they're not dealing with homelessness and they have a homeless problem, if they're not dealing with workforce and affordable housing, they can't access that money in the way that if they do. So bringing back redevelopment and those items I just mentioned are part of what I would do as governor of California.
I found that a very, very interesting question because more or less everybody had a different idea of where the affordability issue was focused: education, student loans, housing, poverty in general, to California's. You're talking about solutions that require money. Where does the money come from? Where's the magic source?
Well, we're talking about solutions that we got to grow the pie. We got to grow this economy, and we've got to grow more middle-class jobs. I agree with Delaine that a key to growing middle-class jobs, in addition to more union jobs, is educating people for the jobs of the 21st century. By 2030, in 13 years, we'll be 1.5 million down in the number of college graduates we need. We'll be another 1 million down in the number of people with specialized skills. We've got to see this as a crisis that needs to be addressed. We've got to train people for the jobs of the 21st century. There are jobs in your industry today that we'll need more of because of the silver tsunami. And it seems to me that we should be training people for those jobs. We should be ensuring that we're doing everything we can to grow the economy, to improve the business climate, and to grow middle-class jobs.
Grow the pie is your answer. Then John Chiang.
Yeah, so so I was pushing for a $6 to $9 billion bond that the legislature, when they reworked it, was a $4 billion bond. So yes, I was asking for additional money. I was trying to house 500,000 Californians who need additional housing in this state. But the increase for the 80% in new and rehabilitated housing, I just fixed the rules and pushed out the federal dollars that had been backlogged in the Treasurer's office. So I improved the processes, worked with the private sector, both nonprofit and for-profit organizations, charitable organizations, and developers to make sure government was much more efficient so that we can increase the stock of housing. So in that case, we didn't require additional monies.
Okay. And Delaine, you brought up the education point, and Antonio has more or less said in the chicken and egg world, it's the thing that comes first because that's where the jobs ultimately will come from. I just want to give you a little bit of a chance to expand on that thought.
Well, I mean, look at these people that came out of a Great Depression and a war. They managed to build 9 out of 10 UCs, all but 3 of the CSUs, all but 2 of the community colleges, and to build great K-12. They didn't have hardly 2 nickels to rub together. What they had was courage, vision, and heart. That's what's missing in Sacramento right now. We are doing timid little things, bashful things, rather than the big things that need to be done. Healthcare for all, yes. Affordable housing for all, yes. But especially education for every single child. The truth is the steepest brain development is 0 to 5. It's not when you get to kindergarten, and by the way, kindergarten's not mandatory in California, disgraceful. So let us get together here and understand that education is the absolute foundation, not just of the economy, but of the democracy. It's people that have good education, that aren't racist, that understand and embrace LGBTQ and immigrants and DACA and all sorts of other things. Education is the key that unlocks all the golden doors. And by the way, every kid needs a great education, and some of them aren't going to college. The machinist needs trigonometry. The mechanic needs an amazing amount of arithmetic. And don't buy a house built by a carpenter that doesn't know geometry.
Let me jump in. And Gavin Newsom, you bring it home on this section. The floor is yours.
Look, I mean, a lot of it does require resources, absolutely, but also resourcefulness. It's a question of commitment. It's a question of what you value, what you prioritize. I mentioned, and look, we're on the same page as it relates to education, the power and importance of early childhood education. When we did it in San Francisco, we were in the midst, as I said, of a big recession, and yet we still found the resources to make the investments. And so I always find the argument of money more of an excuse for the lack of imagination that's required to solve big problems. And as we said on the healthcare, back to sort of the frame of today's event, the money exists in the system. It's just not being used effectively and wisely. And so that's my approach to solving some of these problems.
Okay, so that concludes our questioning round, and we're scheduled now to wrap up by having closing statements from each of the debaters. And to be honest, we scheduled 30 seconds each, and I'm feeling it's too short. It means the program will be 2 minutes longer if we let them have a minute. Is that okay with everybody? Is that okay with? All right, so thank you. I saw you're fast on the clock. They're all seeing a clock in front of them, and it just jumped from 30 seconds to a minute really fast. So these are going to be 1 minute closing statements. Does that throw anybody off? You're all pros. Okay. I thought suddenly I see somebody, looking at both sides of the paper. We're going to go once again for this section in reverse alphabetical order. So here making his closing statement and his appeal for your vote is Antonio Villaraigosa.
I want to thank you for having this important debate. Important enough that all 4 candidates are here today for the first time. I also want to thank you for being on the front lines of universal health care, on the front lines of mental parity, on the front lines of the notion that there's a consistency between what's good for the people who provide the health care and the people who get that health care. I'm running for governor because I believe the next governor of this state is going to have to focus on growing together, focus on the notion that we can't revel in the fact that we're doing so well, as you hear politicians nearly daily say, when we have the highest effective poverty rate in the United States of America. We could do better than that. And as your governor, I'm going to lead this state and work with you to make sure that all of us grow together and we restore the luster to the California dream. Thank you so much.
Gavin Newsom.
Thank you. Let me share the sentiment of Antonio in his closing statement. Look, at the end of the day, we can't afford to live in this bifurcated hybrid economy where so many people are being left behind. As I mentioned earlier, the issue of social mobility should define all other issues. The issue of the California dream, the American dream, that's in peril. In the richest, again, and poorest state in the nation, we have got to mind that gap. We have to deal with the issue of poverty, not just income inequality, but again, wealth inequality. And back to the issue at hand, health and health care are front and center in that conversation. No other part of our budget has a driver that is more costly and more problematic than the issue of health care. We've got to tame it. And you need a governor that's going to lean into this, that's going to lead in that debate, that's going to hit the ground running. And I hope to be that governor. And I want to just close by saying this. You also need someone who's going to be bold. Someone who's willing to step up and step in and help shape public debate. And that's something in my entire career I have tried to advance. I would love and I'd be honored to have your support for governor of California.
Delaine Eastin.
Thank you all so very much for the chance to be here with you today, and thank you for the important work you do nurturing the health of the people of California. I'm here to say that I think we can no longer sit idly by and let a wealthy elite dominate public policy in the state of California. We need to return to a government that is of the people, by the people, and for the people. I have to say to all of you, I have values, and my values cannot be bought. I am not for sale. I am here to fight for, yes, great health care for all. Yes, great educational opportunities for each and every child. And I have seen the amazing children of this state, and they give me hope, and they give me something more. They give me optimism. And at the end of the day, that's one of the things I bring to this. I bring optimism about the future of California. I'm going to fight, yes, for affordable housing, and yes, for great, clean environment. But I'm also going to fight for each and every one of you, for the rights of Californians to be great and to dream wonderful things and to do right by the future. Thank you very much.
John Chiang.
Today, we know that labor and working people face existential threats. Since President Trump assumed office, nearly every single day, I think not on our watch. Not on our watch are we going to let Wall Street dictate our economic future. Not on our watch are we going to have toxic leadership divide us. Not on our watch are we going to have people pull back and lose their health care. We know that together we stand for something better. Together we can build a road of prosperity that includes all of us, California as the land of opportunity. Together we can understand that we can build something that's never been seen before, because that's truly the spirit of California. We know when we work together, we stand, we organize, we win. I respectfully ask for your support if you want a more brilliant and brighter future. Thank you very much.
So my work here is finished in just a moment. I just want to say what a pleasure it was for me and how fascinating it was. I did not know any of these individuals. I'm not a Californian. I didn't know them personally. What really happened today is I feel I got to know who you would be as governor, all four of you, and I thought that was an excellent, you played, you brought game, but you brought respect for one another. There was not a single personal attack made by one candidate against the other. And I also want to say I do a lot of these debates, and having to talk in 1 minute is really, really hard. It's not a piece of cake, and they adapted, and they let me push around a little bit, and they corrected me when I made a mistake. I congratulate you for the spirit in which you participated in this thing today. Thank you so much. I also want to thank my colleagues, my fellow journalists, for the questions they brought, the intelligence and the perspective. Thank you so much. And to the organizers of this event, you have been a pleasure for me to work with as an outsider, totally professional, told me everything I knew, held my hand along the way, so thank you all very, very much. And I want to say, so thank you for that. I know you have an important decision to make shortly, but before you do that, I want to hand the stage back over to your president, Sal Roselli.
You know, first of all, I want to thank John. Let's hear it for John.
Oh, thank you. We're hiding.
You can be sure that this union's going to do this again, and I hope you'll come back.
Sure, I'd be delighted
and
to.
help us do that.
Yeah,
and I too add our thanks, right, to the journalists. Appreciate your time, right?
I'm going to exit.
Okay,
Bye-bye.
thank you. I want everyone here to know that these four political leaders, all four of them, are good friends of NUHW. But let's hear it for them, right, in this terrific job. And, you know, our bottom-up democratic process just isn't about empowering our members to make decisions, although that's obviously fundamentally important. But it gives us the opportunity to organize folks to understand the political system and get involved. And I assure you, whoever gets our endorsement, you can be sure that many of us and our members are going to be on the ground doing everything we can to help you get the nomination. And whoever gets the nomination will be there for them in November to make them the next governor of California, right? And finally, historic event for us. So we just have a memento to give to you to commemorate this historic event. Thank you all again, and thank you all again.
Jeff, thank you so much. Thank you. Thanks, Mayor Paula.
Hey, great job. Thank you, sir. Thank you. Thank you. Thank you. Okay, folks, the polls are open, right? Outside these back doors.